I think there's no straightforward answer to that. I think at this point, I think we can say that neither are more dangerous than the other. I
Yeah.
think for your audience, I think, and for us all, I think we just need to bear in mind that this virus has been, if you like, evolving. There have been different variants throughout this particular period. So when a virus infects a particular cell, it has proofreading ability, but there will be mutations in the genome,
Yeah.
and that leads to changes on the protein and the surfaces, like the spike protein that I'm sure your listeners are becoming more and more aware of.
Yeah.
And so it's very difficult for us to really say that these particular changes, and if you look at the official statements from from the United Kingdom organizations, and from what Professor Salim Karim has stated last Friday, if you look word for word, they're very similar. That there are concerns, and we must certainly be concerned. But I think the evidence needs to be built up to show that these particular variants lead to specific changes that are of concern around, for example, transmissibility in terms of severity, and severity around not only in the old age groups, but also in the younger age groups, as well as immunity as well. So those are the sort of key areas I think that information needs to be produced in order for us to really understand, because we will continuously have variants.
Yeah.
Some of these will arise by chance, and that is the whole point. And but we really need to then investigate quite clearly what these changes will mean.
Given that the science around this variant, then, Professor, is still inconclusive, is it fair for the UK government to say that the South African variant is more transmissible than the one they are experiencing in the UK?
I think it's a very difficult question. Now, obviously, within the UK, as you know, they've been going through different phases and have seen a remarkable growth in the numbers of cases. And I suppose knowing that there is this variant from South Africa that is linked to an increase in transmissibility, the thought is that, well, we therefore need to control that. But I think it's going to be very difficult, as the UK knows as well. That variant virus is now in circulation in Europe already. So I think closing down borders under these circumstances, I think, becomes very difficult.
Yeah. Then there is the element around beaches here in South Africa, Professor Purian. I just had a conversation with the operations manager of the Western Cape Health Department, Mr. Karim there, who says that, well, look, outside, when people are at the beach, perhaps the transmission rate is negligible. I'm not trying to say these were his exact words, but I think he sought to say the chances are minimal, given that you are in the outer space as opposed to a confined space. Is that argument holding water when we have a situation at hand that says the variant or this new type of coronavirus we're experiencing is more transmissible?
I liked your pun about referring to the water scene, but I appreciate that very much. I think it's a very difficult question, in the sense that we need to take multiple things into account. So yes, being indoors in a poorly ventilated scenario with large numbers of people that are not physically distant, not wearing masks and so forth, is not the ideal. Being outside, being in the open air, if you like, close to water, where sea breezes are there, it certainly presents a more, I think, ideal picture. But I think you need to take into account the same things that I've spoken about into what I've just spoken about in the closed environment. So again, people are traveling to this particular beach. So what's those conditions like? You're at the beach. There are large numbers of people who were initially in their own isolated bubbles, possibly, now coming together in close contact, merging, not knowing the histories behind each other. And that can set up, and there's exchange of items and so forth, closeness, talking and so forth. So all these conditions, again, build up that risk. And KwaZulu-Natal is really going through a very rapid trajectory, and you can see that in Johannesburg. So if you think about mobility and people traveling together, all melding together in this particular scenario where you cannot control or will find it very difficult to control physical distancing, the wearing of masks, making sure that the facilities are clear, clean, hygienic. These are all the factors, and how are you going to manage those risks?
Yeah.
I think does not change the fact that it's out in the open air. You still have to manage those risks, I'm afraid.
Yeah. Professor, I want us to conclude this discussion around beaches in this way. And in an effort to try and be fair, economic imperatives are just as important as saving human life. However, is there sensibility in keeping these beaches open? Let's not just focus the attention on the Western Cape. KwaZulu-Natal, as we now know, beaches there are open on days that are not public holidays, because that's when people, even those who are still at work, are going to probably descend onto the beach. Then there are, of course, the instances where people are going to be going to beaches. Nutshell, beaches, should they remain open or closed given this new variant?
My sense is it's the same response that I gave you earlier. You need to manage the risk. I think regardless of the fact that there is a variant in circulation, we will always have variants. The only ways in which we can prevent prevention and transmission of this virus are the key things: physical distancing, the wearing of masks and wearing them correctly, ventilation, and all the hygiene steps that are required. So in a beach scenario, the management of that beach needs to know, how am I going to manage my staff and keep them safe, the facilities safe, as well as the community that wants to make use of that beach safe. If you can have the answers to all of those questions in detail and manage it correctly, then yes, that beach can remain open. But if you're going to struggle, if you don't have the staff, you're putting your staff at greater risk, then I think you need to make another decision and balance that against the economy that you're speaking about, which I think is so critical.
Yeah. Prof, at which point in the medical science world are we going to be able to tell, with these new variants of this virus, whether it is more severe health-wise or less severe, negligible, if you like?
It's a very difficult question. Again, coming back to the science, how do we answer some of these questions becomes very difficult, because you want to know, how is this variant behaving compared to other variants, in terms of you need to do some laboratory experiments, setting those up, looking at serum banks of previous or prior to this variant with the current variant. So there are some laboratory experiments that are critical. Looking at the data as well, in terms of the hospitalizations that we're seeing, what are the age groups, what are the comorbidities, have they changed versus what we saw previously? And again, those types of research become very complex and very difficult. So we may not always be able to answer immediately. But I think just coming back to your point around whether I keep the beach open or not, I think is to keep in mind, when you look at the dashboards that are being released each day, and you look at the hospitalizations, you look at the deaths, the needs for oxygen, those are still things which we talk about, the fragility of our health systems. So we balance the economy, and I believe you're quite right. We can't say it's either or, but how do we balance that? What is government going to do to support business, for example, under these particular circumstances, or communities, in order for them to survive? Those are the key questions, versus seeing a dashboard where people are actually being hospitalized, are dying, don't have access, or don't even reach the hospital. So I think those are the key things. So I think the variants will always be there. I agree with you that we need to understand whether or not how critical these variants are going to be, and whether or not we are able to change the way in which we will manage cases, for example. But I think that will come at a later point, I'm afraid.
Yeah. Prof, you touched on the age groups. And yesterday I had a conversation with an academic from UJ who said, if you look at the demographic profile of the African region, you have more young people than elderly people. Therefore, a hard lockdown was a wrong decision to begin with, and we should never go back there. That's a question I want to pose to you, because it's a very interesting one when we talk about economic imperatives, because then they started talking about the targeted interventions that will better suit the conditions on the continent, because you have more people who are less employed and who live in areas where you are unable to social distance. With this new variant that is transmissible faster than what we saw first, the likelihood of a lockdown, a hard lockdown at that, is that something that should even be in the offing from a government point of view?
So I think WHO have been quite clear about lockdowns. I think it served its particular purpose at that particular time. We're in a different phase now in terms of our understanding of the virus to an extent. We have interventions that we think have thought about hard and long. And I think it's really a matter of saying, well, we don't want to head back to level 5, which has had a really marked effect in terms of our community, as our society and our economy. So within that framework, within those different levels, are there opportunities for us to actually try and prevent transmission? So, for example, it's the reinforcement, the re-engagement with communities to try and see how we can prevent transmission. Because again, in terms of our non-pharmaceutical interventions, we're limited to what we can do. But how do we manage that? How do we get people to really take seriously around the physical distancing, both those who are running our economy, as well as we as the public or the community, in terms of the physical distancing, the wearing of masks, the hygiene? Those are still, unfortunately, the key aspects. And also the nuanced ways in which we can commute, travel. How do we manage those sort of things? The restaurants and so forth, in terms of the numbers and sizes of those particular activities, and really understand and how to sustain it, I think, is really difficult.
Well, Professor Adrian Purian, thank you very much navigating those tough questions. Very tricky indeed.